Peter Sunderland. James Sunderland, sorry.
Mr Robertson, a great pleasure to serve under you as chair, and congratulations to my good friend from Beaconsfield for securing the debate. I listened to my honourable friend's from Waveney speech, and I'm sure he was looking over my shoulder when I wrote mine, because some of the themes I think are quite similar. I find myself in a very curious situation here of raising NHS services in East Berkshire. Why is that curious? Well, because we're pretty well served, actually. The NHS is pretty good locally. We've got 3 fantastic hospitals on the doorstep. Frimley ICS is one of the best performing care systems in the country, and recently had a reprieve from the new Health Secretary when he looked at breaking it up. So we're in a pretty good place. And I don't tend to get letters from constituents about the healthcare they receive. It's very good. But in this particular case, I have been, and I'm quite concerned about it. So what's the perception of what people are saying to me? Well, first of all, GP practices under the current policy must now ensure they're offering face-to-face appointments. Only 57% of appointments across the UK are currently face-to-face, versus 79% pre the pandemic. So there is an issue. And the perception also is that there's difficulty in getting through to the practice on the phone, availability of appointments, and lack of face-to-face. Constituents are never wrong. My constituents are not wrong. And if they're writing to me repeatedly about these issues, clearly it's incumbent upon me as their MP to raise it, as I'm doing right now. So what's the positive news? Well, the narrative is actually very positive nationally. If you look at the current statistics from the Care Quality Commission, the scores on GP access actually are the highest they've ever been. 67% satisfaction rate now compared to 63% last year. Same-day appointments have gone up. People are satisfied with what they're getting from their GP. So an 88.7% satisfaction rating of good or very good. And as of August 2021, this year, 23.9 million GP appointments offered and recorded, compared with 23.4 million 2 years ago. So things are getting better, things are going up. The service, statistically, is improving. And that's in addition to 1.5 million COVID-19 vaccination appointments delivered in August 21 by GP surgeries. So it's good news. However, the data that I'm hearing and reading appears to be in contrast to what I'm hearing locally. And I agree with my friend earlier that there could be a postcode lottery at stake here, or it could be related to the service provided at individual constituency surgeries. And demand is clearly outstripping supply. So Houston, we've got a problem. Give you an example. One constituent spent 45 minutes on the phone to a particular surgery, tried 159 times to get through, and was then offered a telephone consultation for a lump on her neck. Not great. Constituents have dialed 111 and been advised to contact their GP, and after being unable to get through, to phone 111. And again, we've had multiple complaints from certain constituents in a certain part of my constituency, I won't say where, it's not fair, informing me that the practice has 20,000 patients and only 2 doctors. The figures don't work. Telephone triage is being used instead of immediate face-to-face. And for flu vaccinations, one particular group practice is advising constituents to travel to the central hub in Bracknell, which causes issues for those less able to travel there. So we have a capacity problem. But by the same token, as mentioned earlier, it is unacceptable that staff are working under challenging circumstances and facing levels of abuse not previously seen. GPs and staff are working harder than ever before. Retention is an issue. Staff satisfaction is an issue. MPs, therefore, like me, must do more to help redress that balance and to balance the narrative. But by the same token, GP surgeries also need to take the inquiries that we raise of them more seriously. GPs are not the enemy, and MPs are not the enemy. So my advice is this. There are things that I think we can do, and this is general advice to GP surgeries, if I may. First of all, we need more staff. Let's recruit more staff. Let's do more to recruit more staff, particularly receptionist staff and telephone staff. We need to reassure patients a bit more. They want TLC after the pandemic, and it's right that they get it. We need to sort out the phone lines. We need to improve the electronic referral systems. In Bracknell, we've got this thing called the New Primary Care Network phone system, whereby calls that can't be answered by a particular surgery will be rerouted to another surgery. This is quite exciting. We also need communication. Surgeries need to communicate with their patients. Tell the constituents what's going on and explain to them why their calls are not being answered. MPs need to visit, and I'm visiting one surgery next week. And basically, let's improve the customer service. But in the interest of time, I just want to raise 3 quick final points in conclusion. First of all, care providers across the country and in East Berkshire are working miracles, but are accountable to their customers. And I would urge GP surgeries just to think about what the customers are saying to them, please, and to do what they can to reassure them. My second point is really addressed to the Minister. The new IPC guidance is forthcoming. Can I please ask the Minister when this will be published and when indeed GP surgeries are going to get a bit more guidance from you on what that means? And lastly, I would simply urge everyone listening to this just to watch the language being used. We're all working hard, we're all in the same space, doctors are working really hard, staff working really, really hard, so let's please tone it down. All of us here are part of the problem, but also part of the solution. Thank you.
Now come to the front bench speeches. I'd like to leave a couple of minutes at the